Jure Murgić. I'm working in the second largest Croatian hospital, and I present this data on behalf of Croatian Uro-Oncology Group. We all know that neoadjuvant chemotherapy for muscle-invasive bladder cancer is standard of care, however, globally underutilized. This project was initiated in 2021 within Croatian Uro-Oncology Group. Presented here is the second analysis covering period from 2015 to 2025. There are several aims of the study to evaluate real-world adoption of neoadjuvant chemo in Croatia, determine the rate of complete pathological response, major pathological response, and determine oncological outcomes. So within the study, we captured more than 95% of NAC national administration given public health system, covering 297 patients who were mainly in ECOG 0 performance status with median age of 67 years, in stage 2 with 28% of histology variants, mainly CT2 stage and CTN 0 stage. Most common NAC protocol administered was gemcitabine cisplatin, 72%, and 24% dose dense and WAC. So toxicity of NAC equal or more than of 3 was observed in 45% of patients, cystectomy done in 78% of patients, and in 41 patients, the cystectomy was not performed, mainly because of disease progression during or after NAC or patient refusal. No adjuvant nivolumab was given. So we see constant rising, continuous rising of NAC cases per year during the study period. In all cohorts, in total of 229 patients, we observed pathological downstaging of any grade in 52% of patients, major pathological response in 40% of patients, and pathological complete response in 22% of patients. Median disease-free survival for entire cohort was 37 months, and median overall survival 54 months. 1 year disease-free survival and overall survival rates were 73% and 86% respectively, and patient predominantly recur distantly. On multivariate analysis for disease-free survival, the most significant factors associated with DFS were clinical T-stage and all pathological endpoints. However, most significant hazard ratio of 0.2 was observed for major pathological response. Similarly, for overall survival, variables associated were clinical T-stage and all pathological endpoints. Again, major pathological response with most significant hazard ratio 0.3. In conclusion, NAC in real-life clinical practice is not barrier to timely cystectomy. In majority of the patients, our results are aligned with other real-life NAC series, and achieving either of these pathological endpoints is associated with longer DFS and OS. So in unselected patient population, the role of PCR rate was 22%, in line with other studies, real-life nature. NAC use should really be maximized through close multidisciplinary efforts. And this study was possible by general contribution and sharing of their patient data with my Croatian colleagues, oncologists within Croatian Uro-Oncology Group. Thank you, and I do hope I will see you live in Portsmouth in a few weeks.